Hello viewers, in this video today, I have with me a consultant physician. She's really helped a lot of people when it comes to their medical history, especially family medical history. And today, you're going to be hearing things that I know would really help you when it comes to knowing your medical history and how to tackle it. A lot of people are just not in the know. They are ignorant when it comes to all these things. And that has caused quite a number of things that are not needed. For instance, like people repeating their parents' medical history, which is unnecessary. So we want to be educated when it comes to this, because if you do not have your health in the proper place, you wouldn't be able to enjoy life, because health comes first. So with me today in the studio is Dr. Goodman. She's a consultant medical doctor in community medicine, and I know she's the expert to talk to when it comes to this particular case. You're welcome.
Thank you very much.
All right, so I want you to introduce yourself. Just say one or two things to people at home.
My name is Yinka Goodman, a doctor, of course, and I've been in medicine since 1998, so that's pretty long. Presently, I work in the field of public health, and which I believe enables me to reach by far more people.
Okay, so today's topic is something that I know my viewers will be very interested in. And one that's when it comes to family health history. So many people don't even know that anything like family health history exists. Someone like me, like a lay person, I might really want to be educated about it. Is it just something that we hear? Is it just a terminology that is common that people use? Or is there anything called family health history? Can you educate us about it?
Okay, family health history. Well, a number of people may relate to it that way. Though usually, when an individual or any person is facing or is face to face with a physician, one of the things we would be interested in and we would want to know, especially in order to be able to arrive at a diagnosis for that person, is we would want to know the person's family history. Why this is important is that there are some diseases that have been known to run in families, one, and for some other diseases, they are genetic. So if any of these conditions exist, you never can tell. That may be partly what the individual is presenting with. You would just want to know, depending on the symptoms that particular person is presenting with at that point in time. So we usually would want to know, because as doctors, this may help us to arrive at a diagnosis for that individual.
Okay, so what you're saying in essence is that there is something called family health history,
Yes,
and it plays a major role in diagnosing any patient that, especially when it comes to certain kinds of diseases, right?
Yes,
All right.
absolutely.
Oh, okay. So now I want to know, are there patterns that can be seen in the patient's medical condition? Are there patterns that you can see that will point to the fact that this should be a repeatable family health history of their family, or the person has to be diagnosed first? Maybe you have to go to the laboratory before you can decide that, oh, this thing must be from the ancestors, or maybe it's part of the family health history of the person. Or are there things that you can see, which are patterns that show that this thing may be the family health history of this particular patient?
Okay, so when we're talking about family health history, usually they relate to non communicable diseases. I mean, diseases that are not infectious. Yes, so for diseases that are infectious, those diseases, they have infectious agents. So you may be talking, for instance, about a viral disease or about a bacterial disease, that kind of a thing. So for those kind of infectious agents, they are not likely to be carried along bloodlines, meaning that that individual has come in contact with it in the environment. But when we are talking about family health or family histories now, most of the time, or even almost all of the time, they do not have to do with infectious agents. So there are diseases, for instance, that we will call non-communicable diseases. So let me take a key one, especially that would affect us in a region like Africa. We know that we have um, sickle cell traits is very common amongst us, for instance, and so we have a number of children or a number of individuals that may come down with the sickle cell disease.
Okay.
So if, for instance, a patient comes to the hospital, this person has just complained of all kinds of things. Oh, I have this, I have this. Well, depending on the age of the person, and these are things that we have studied and that we know. So if this person comes with that kind of a condition, one of the things I may want to ask, what is the genotype of your father, for instance? What is the genotype of your mother? By knowing that, there are certain things I will be ruling out. I will know that it's not likely to be this condition that is wrong with this person. But if those things possibly they are there, I may know that, oh, this person may probably have a sickle cell condition. Yeah. So those are the kind of things we mean. That is on one hand. On the other hand, for some people, you may not even be able to say, oh, once the person has said one or two things, you would know that this may be likely. And based on that, we would want to send the person for further investigations
Okay.
for a better evaluation.
That's good. All right. You made mention of a few things. As a layperson, I would just want some clarification. And I know the same thing applies to the people watching me at home. You mentioned something like communicable or contagious. Are they the same? Those words, are they the same?
Okay, so when we talk about communicable diseases, they are diseases that can be transferred from one person to
Okay.
another. So for most of these diseases, in fact, for all of them, that's why they are communicable, is because they have infectious agents
Okay.
causing those diseases.
Okay, please, can you give some
So,
examples?
for example, if you talk about things like cough,
Okay.
you know, if I'm coughing, or tuberculosis, let me give a typical example. If I have tuberculosis, for people around me, I am likely to give them tuberculosis
Okay.
because tuberculosis is caused by an infectious agent, which
Okay.
is a mycobacterium. So when I cough out, part of the infectious agent is going to come out of my sputum or my saliva. They could get on substances and the next person can get
Get
them.
the
Yes,
diseases.
yes, yes. The
So,
person
but
can get
somebody
them.
can have, it's possible for someone to have communicable disease or for to contact an infectious disease, but still that thing may be a family thing if it's traced or it's not compulsory.
It may be common in a family, but it
Okay.
does not mean it is passed along bloodlines. So let
Okay.
me explain it this way. For example, I was talking about tuberculosis, for instance. So if somebody in a particular household has tuberculosis, because they live together, they may share cups, they may share beddings. So other members of the family are exposed, but it is caused by that infectious agent. But it does not mean that apart from that, or if they get cured or they've gone through treatment, it does not mean when they give birth to children, their children would likely still have that condition. No. So it is communicable. So within families, if they live together, but that is not even limited to their family people. If they have other people living with them, they may be guests, they might have come to stay with them for a little time, they are also exposed. And that was what happened in the case of things like Ebola. You are asking of histories of travels. Probably they had contact with anybody that had something similar. So it's possible these agents are transferred that way. But that does not mean that those agents will be transferred along blood lines. Yes.
Okay. Now, before I go to my next question, I think it's very necessary for us to have some examples now. I want you to give us some examples of diseases that might be as a result of family history.
Okay. So, for example, we could talk about something as simple as hypertension.
Okay.
We find hypertension along bloodlines. We could talk about disease like diabetes.
Okay.
There are things that are seen, although at times for some of these diseases or conditions, they might not be specifically linked to a particular gene. So, but they have been found along bloodlines. So that way we will say that they are familial, which means you find them along family or bloodlines. But for some other conditions, those ones are genetic. So we could see disease like that. For example, a good example I talked about earlier was sickle cell disease.
Okay.
So parents can pass that down to the children or the traits. along bloodlines. Other conditions, for some cancers, they have been found, they have been genetically determined. And for some things like that. So we would want to find out, a person comes with a particular condition, do we have, is there history of this cancer? And at times, especially for a disease like cancer, so much research is still being done on conditions like cancer. So we're not talking about a particular cancer, but even if there has been any, there might be that tendency that somebody along the bloodline would also pick it up.
Okay. All right. This is so good. I know you'll be talking more along this line when it comes to your recommendations. That's the next question now. What do you advise? Because a lot of people are even ignorant about all these things. They don't know that, okay, it's something that if they find out that, okay, this is along family lines and they can do something about it. And some, they know, but they might think it will cost a lot of money to be going about all those kind of medical findings. Because if it can be prevented, why can't I go for the prevention? Maybe by avoiding some things or by taking certain steps.
The very first thing I would say is for every family, because a child is born into a family and we all belong to families. The very first thing is, it is important for every child, for everybody to know the history, health histories that obtains in their family. Unfortunately, in Africa, or even if I cannot talk for the whole of Africa, I can talk for Nigeria as an example. We make a lot of things mysteries. And it's because we have myth concerning certain things. So, for example, even things as simple as age, you ask so many people, how old is your father? They don't know. How old is your mother? They don't know. And that is so basic. So, when you don't know it, so a father or a mother has died due to a particular disease, the children do not even know. And I think that on its own is wrong. So, if a person is aware, it makes every individual self aware, and there are steps that we can take to that. So, once a person knows, that's the first step in the right direction. But most of the time, we do not even know. So, if a parent has something they feel, oh, maybe I shouldn't make my children feel so bad. I shouldn't, they hide it. So we hide a lot of things. You know, we live in a world of secrecy in Africa, especially in Nigeria. Everything is a secret. Every single thing is a secret,
Okay.
especially within a family. I'm even so particular about family now
Okay.
because we're talking about things that could run along bloodlines. That is one. And then, in Africa, especially in a country like Nigeria, we also spiritualize a lot of things. And when I mean spiritualize, whether positively, negatively, one hand is whatever is wrong with you, you feel that this must be from the enemies, that there's one enemy somewhere. And the truth is, there is no enemy anywhere. You think about people from your village and a lot of all of those kind of things, which may not be whatever it is that you are thinking that might have gone wrong with the person. That was never even the cause in the first instance. So all of those kind of things, they affect people. So people would not even know, because rather than at look for the medical reasons or the medical prevention for that condition, they are so much glued and focused on the spiritual, somebody from the village, and all of those kind of things, which will not even help in any way. Yeah.
Okay.
So the first step is know what obtains in your family, because once you know, it helps you to be able to take steps that would help. Number two step is, for communicable diseases generally, we have laid down things that people can do. One, watch your diet. Diet is very important in non-communicable diseases. For communicable diseases, all those things I said, oh, you're having malaria, you're having this, all of that may not matter. They may just help to boost your immunity. But as far as non-communicable diseases are concerned, what you eat, it affects a lot of things about you. They affect the way your cells are and even the way you can respond to things. So, what you eat, avoid as much as possible processed food, foods that are processed, foods that are high sugar content, foods that are high oil, fat and oil, and then, as we all know, everybody's going green. Eat as much as possible. Lots of vegetables, lots of food, foods that are not refined. They are just always our best option. Avoid and go away, very far away from processed food,
Okay.
whether processed meat, fine. I may not say don't eat meat at all, but ensure that it's not the processed one. Things like bacon, ham, a lot of those things, they don't help. Eat your raw meat if you have to. Eat just the one that's been killed. That is always better. Whether it's poultry, just avoid sausages, all of those things, they are processed. So avoid as much as possible processed food
Okay.
and eat natural food.
Food.
They help. Yeah,
That's
so
all.
apart from diet, we talk about exercise. Exercise is good because when you exercise, you burn calories. You're not only burning calories, it helps in free radicals and all of those kind of things, and maintain the right weight. Because if a person does not maintain the right weight, you are overweight, you are obese, those are key things that affect a lot of these non-communicable disease. And whichever one we go, it's just the same thing that we'll be saying. Yeah.
This is excellent. I can remember that growing up, my parents used to talk about hypertension. Hypertension. I didn't know what it was until later in life, and I discovered that hypertension had to do with high blood pressure. And the much I can remember, both of them were hypertensive. Of course, they were able to manage it. So when they now say talk about family history, I was thinking now, which means me too, I'm predisposed to having it if I'm not
Kind
careful.
of, yes.
Okay. So all these things that you talked about, even if I know my family health history, that both parents were hypertensive, I can control it.
Yes.
Okay, by
Yes.
taking some of these steps.
Yes.
All right.
Okay. The other things we can talk about. So a lot of them, they have to do with lifestyle. They are
Okay.
just lifestyle. So we're trying to ask about your social history. There's what we also call social history. Oh, are you a kind of person that drink? If you avoid alcohol, reduce alcohol intake, avoid tobacco, those are the kind of things. Have adequate sleep. These are things, they are basic and normal. If we can do them, it prevents us from having a lot of those diseases. And lastly, one of the very important things I would want to talk about is about screening.
Okay.
Please and please and please. And that is why I'm saying when you know what your family history is, for a number of these diseases, there are screening tests for them. They are known. So, meaning that for a person, for instance, if you do not have this family history, generally there are times people do outreaches, even in a country like Nigeria, and some of those trainings may be made available and they're just doing it at random, or most people, some people may never even go through it, maybe they've never attended any of those. But for a person that has a family history, all that means is that this person has to start earlier, so that peradventure this person is going to have it after observing all of the things I've talked about. Modifying your lifestyle, it can be detected early, because the truth is a lot of these conditions you do not have to die from them, because if they are detected early, you can get adequate treatment and then you can nip it in the bud.
Okay. Thank you so much. I just want you to address this before we close. What will happen in a case where someone has discovered that, let's say, it's too late? Don't let me say it's too late, in quote. Now the person has discovered that they are on the high side of hypertension or diabetes.
Okay.
They didn't know all these things in time. Maybe they're just watching this and they discovered that, oh, so which means I could have done something about it.
Yes.
Now that they're just discovering, what can they do? Is there still anything they can do?
Yes, there's something they can do. Now, I think I'll just take a few steps back before I address the issue. And what I mean by that is people are not proactive about their health, because most of the time we do not know the consequences that go with it. So, if a condition is diagnosed early, or if a person is aware and taking steps in that direction, one is either it delays the onset of that condition rather than have it so early, even if the person would have it. So, for instance, let me talk about something like hypertension. It may be possible that there's no way this person would die by hypertension. I'm just thinking. But rather than have it at 40, is it possible the onset for this person is at 65? But at least this person would have lived 65 good years. You understand the kind of thing I'm talking about? And at that time, at 65, even if it's certain in what you have, the number of years you have ahead of you to live is not as much.
Yeah.
Because the consequences of most of this condition, they are great.
Okay.
Let me put it that way. For things as high as for something as common as hypertension, for instance, is because people do not even know what the consequences are. So most times, all that people know is that hypertension, maybe a person could have stroke, and that is all that is known. I remember seeing a particular patient at the clinic once, and this woman was hypertensive. And when I saw her, it was already documented in her case notes, and I was not even the person that saw her. So at the time of seeing her, I was not even looking at that. I asked her, she said she didn't have a history. On the day I was seeing her, her blood pressure was raised. But she told me she had been diagnosed at some point in time and she was given drugs. And after she took those drugs, she was okay and she never went back to them again. And then I laughed. I told her, I said, no, that was where you missed it. Because if she had been taking her drugs regularly, it's possible a person has high blood pressure and the person can live with it throughout life till death. But whereby this person is not doing what he or she ought to do, it means that the complications will set in. And the very common one that most people know is stroke. Fine, they do not, and stroke can be serious because it means you don't ever get your life back or you lose some motor functions, that is movements and all of those kind of things, either of half of the body or those kind of things. And that's what people know. But in as much as we're saying that, part of the reason it's good for you to have an early diagnosis is that hypertension on its own can cause enlarged heart.
Okay.
And when a person's heart is enlarged, there is tendency that that heart would ultimately fail. So we do not want the person's heart to get enlarged. So it is better you start getting treatment early enough so that the heart would not get enlarged. One of the other key things hypertension may do to an individual is that hypertension may cause the kidneys to fail because it means that there's so much going on in the body and the kidneys cannot even cope. So ultimately, that kidney would fail. So at some time, you will hear people talking about kidney failure, which may be due to this hypertension. So hypertension is something that could even affect the eyes. So hypertension, we call it like a pan-systemic disease. It's like it's affecting almost every part of your body, every key organ. So we do not want it to get to that stage. So coming back to what you have said, so it means that now this person is already hypertensive and the person is knowing. But the very day hypertension sets in, you don't know. So for how long has that person been hypertensive now? We really do not know. But from that point, if the person goes on regular medication that he or she has been given, and this individual modifies his or her lifestyle, it is likely to help. It means the person will not now progress to having the complications of hypertension. I know people, even some family members that are hypertensive, and they never came down with any of those complications of hypertension. But if the person does not play within that circle, that person is likely to come down with the high blood pressure. So if the complications have not set in yet, it's better for the person. But when the complications have set in, then we begin to think of how they really can be managed. Because once the complications set in, you really cannot say how fast they would progress.
It's so good. My mom just told me something recently. She started complaining about her sight. She said she wasn't seeing well, she couldn't read well, and she was thinking that maybe it could be glaucoma. Eventually, she went for a test, and they said it was just she just needed an operation. And when they did the operation, it was corrected. So I remember calling all of us, telling us that we should go for medical checkup because this might be a family thing. Because when she was complaining about that, her younger brother too was complaining about the same thing.
Yes.
That's on one hand. On the other hand, myself and my elder brother were talking about someone that we know quite well that at an early age had developed or had had glaucoma. I asked about the person's dad, and he told me that the person's dad is there, is at home. I said, is he still alive? He said, yes, but the two eyes are blind already.
Yes.
So trying to look at it, it means that these people have this family history.
History.
They didn't know,
Yes.
like most people. So on a last note, what advice would you now give to people? Some people believe that when you're talking about medical tests or to come for screening, it's something that they can't afford. They think that maybe you require a lot of money or it's not for someone like you. Some people don't just believe that they should go for screening. In fact, I know many believers that when they are exercising faith, they don't need any screening. So I want you to give a final advice, at least for today's episode, so that people will know what to do.
Okay, if I'm going to say anything, or if there's anything you're going to take away from watching this, one, modify your lifestyle.
Okay.
This is pretty important for every single person, because that's way you may be able to delay some of these non-communicable diseases or even avert them completely, eliminate them when it comes to you, because all of those things, whether they are familiar, they must find the right condition with that person. So if you can go after a lifestyle modification, this is totally excellent. One. Two, because there are so many screenings and it may be difficult for one to go through all of them. That is why we're even talking about family history. So especially for diseases or conditions that you have seen present in your family, you don't have to wait till you are 60 or till you are 50, because for most of those tests they'll start talking of from 50, from thereabouts. It means you have to start earlier. Just watch it and it keeps you on top of it, so that in case anything goes wrong, it can be detected early enough. Yeah. So screening is very important. Screening, but because there's so, I am talking of you go for screening for the particular condition that runs in your family. That means you are going earlier than normal, but at the end of the day, you may still end up doing screening for conditions that have screening tests available for them.
Thank you so much, Doctor. I think we'll have to bring this to a close today because of time. Want you to tell people where they can find you online. If you're on Instagram, your Instagram handle, if you have a website, and if you're on LinkedIn, wherever people can find you, because people may want to find out more. And of course, viewers, apart from what she's going to tell us where you can find her, if you have any question, you can put it in the description of this video. And I believe when we send the questions to her, she'll be able to address them.
Yes, yinkagoodman.com.
Okay, yinkagoodman.com. What of
Yes, yeah.
Instagram?
Just Yinka Goodman.
Okay, at Yinka Goodman.
At Yinka Goodman.
What about YouTube?
Dr. Yinka Goodman.
Okay, Dr. Yinka Goodman. We're so glad to have Dr. Goodman here today, and I believe that everything she has taught us will be put to practice by my viewers at home. This is where we'll call it a day. Thank you so much for being here today.
My pleasure.